All right, I'll get us started. Welcome all to our weekly Brown Lifespan Center for Digital Health seminar series. For those who are joining for the first time, the Brown Lifespan Center for Digital Health was created to facilitate the development of effective digital health tools for patients and populations. It is a collaboration between Brown University and Lifespan Health System. I'm Megan Ranney. I'm an emergency physician and director of the Center for Digital Health. And I'm so excited today as part of our learning series to bring you this presentation from Dr. Gillerman. For those who don't know him, Dr. Gillerman is a pediatric anesthesiologist as well as Chief Medical Information Officer for Lifespan. He has been really one of the leading architects of making our use of Epic better, more usable, and more friendly to clinicians, as well as leading multiple really interesting research initiatives and efforts to stretch the boundaries of what Epic can do. He could talk about a lot of different things today, but I'm super excited to have him talking today about SlicerDicer, which is an exciting new Epic tool for all of us that do clinical research. So I'll quiet myself and I'm going to turn off my video and let Dr. Gillerman take it away. Richard, one quick thing is that usually we try to end about 10 to 15 minutes before the top of the hour in case folks have questions. If that doesn't work for you, no worries, but just to let you know.
Great, thank you very much, Megan, and thanks everybody for joining today. So again, just, let everyone know I'm Chief Medical Information Officer here at Lifespan. Now going on the 5th year, amazingly, and prior to that, have been at Lifespan really since 1994, practicing pediatric anesthesia. So hopefully we're trying our best to make LifeChart usable for everyone. There was, in case you don't know, a double upgrade last night. So actually I was a little concerned whether or not the SlicerDicer module was going to be back up and running so I could show it today. But it did come back up at about 10 o'clock this morning. So, so we should be all set. So I'm going to take the bold move of actually trying to demo it live, which is never a good idea when you're making a presentation. But I figure I might as well live a little bit on the wild side here. So I'm going to start with a PowerPoint, and then, like I said, I'll go to a demo. So let me see if I can share my screen here. Okay. So hopefully you're seeing a PowerPoint. If that's not the case, let me know. And I'm going to start here. Okay. Can everybody
Great,
see
Richard.
the first slide? Great, thank you. Okay, so you may have been around, if you're using Epic, you may have been around it enough to know that Epic likes coming up with very interesting names for their various modules. And this one is no exception. It's called SlicerDicer. And we've got a problem, and that is everybody wants information out of Epic or whatever application they happen to be using. And of course, we do have a reporting team, but it's quite busy, as you kind of can imagine. And so Epic has tried to solve this problem by having standardized reporting. You might ask a question, okay? You might ask it in a way that's kind of not using standard language in terms of the way we think about queries, and that would be totally understandable. And so you put that report request in, you figure out what specs there are as best as you can. The report writer comes back to you and they say, well, I don't understand this, and you get back and forth by a few emails, and you know, next thing you know, it's a month later, and you know, essentially now they come out with a report, maybe it's 3 months later. Well, that wasn't exactly what I wanted. So you go back and forth a little bit more, and it's kind of the rinse and repeat cycle. And that can lead to a lot of frustration. And then finally, when you get what you want, you've got to validate it, and then you get your final report. And you know, unfortunately, in the real world of our information services, to be completely candid, that can be 2, 3, 4, 5 months. And that's before you put in revision requests. So this is not a unique problem to Lifespan. When I've talked to other institutions around the country at some of the Epic events, we actually are on the better side. Hard to believe. Sometimes people will wait up to a year for reports. So Epic recognized this, and the question was, is there a better way? What if we could take those reporting tools and put them in your hands to make them more easily usable? And of course, the issue is that you might have a question in your mind, and then you get a little bit of data and your question changes. So, well, what about this issue or that issue or this parameter or that piece of information? How does that affect my results? And obviously, if you have to be putting in revised report requests back and forth, that slows down the process by a lot. So what if we just took that control and gave it to the user? And typically, it's the users who really understand the question they're trying to answer, and that's often very difficult to explain to a report writer. Not that they're not experienced, but because they're typically not clinical, and even if they have some clinical background, it's not in your area. You are the expert, and that's why validation is so important by whoever the person is requesting the report. So if we could do all this, then that would eliminate the wait between the request and the results. And so why is this appealing to the Center for Digital Health? Well, I think of this as the Center for Digital Health as kind of like a think tank. And so if you've got rapid fire a number of questions and you had a way to get those answered, or at least possibly answered, to take you to the next step of, all right, we may have a lead here. We may want to go down this rabbit hole. This would give you the first step to saying, yep, we're going to jump in this rabbit hole. We're not sure where it's going to go, but we're going to jump, versus having to wait 3, 4, 5 months to say, do we want to jump down this rabbit hole? So enter SlicerDicer. Again, Epic's great name. So SlicerDicer is based on what are called data models. And really all it is it's a compilation of fields. Most of you probably know that a database is made up of a number of fields and tables and whatnot. And Epic has essentially done the dirty work for us. What they've done is they've said, okay, whether you want to look at patients or you want to look at surgeries or you want to look at admissions, whatever it is, these are the tables and these are the fields that we think are relevant to those pieces of information. And to be fair, there are many other products out there that have been out there for years which have tried to do exactly the same thing as this, where they've taken relevant pieces of information and tried to group them with some kind of easy user interface that can be used by individuals rather than by report writers. So not a new concept, but Epic decided to take this and integrate it into Hyperspace, and also, of course, in their usual Epic fashion, make it flashy and colorful and somewhat sexy. So they have come out with a number of different models with these related data elements, and they also have given us the ability to add additional what are called custom filters, i.e. add additional fields into a particular model. It's very easily accessed, and it's easily sliced and diced, and you'll see that in a little bit. And so what do you get out of all this? Well, you get the result, which is really a number. And it's the number of whatever the particular model is. So if it's the patient model, it's the number of patients that meet criteria 1, 2, 3, 4, X, Y, and Z. If it's surgery and procedure model, it's the number of surgeries. If it's the visits model, it's the number of visits, et cetera, et cetera. And that's what's returned. So this is a list here of the currently available models that Epic has put out. The ones that are in red are ones that we have live. And then there are 2 others that I have in yellow there. the visits model, which is obviously relevant to the ambulatory world. And that is literally in the process of being built out. And probably the anesthesia records is the one that will be next. I, of course, wanted anesthesia records to be first, but I thought that that would be politically not a great move. So I didn't want to pull that rank. But I do want to get to it for sure. So again, these are all the models. And you can see that a number of these are clinically related, but yet there are also a number of them that are administrative. For example, the denials, hospital billing and professional billing that we just went live with about a month or so ago. And that obviously will be used by financial services. So again, what's returned? Well, SlicerDicer can return really kind of two levels of data. It can return what's called aggregate data. And those of you who have used SlicerDicer, that's what you're used to seeing. And that's what we usually grant to most users. It's granted by what's called a security point for SlicerDicer. And that returns high-level data. So again, it's the number of whatever data model we're talking about based on the query parameters. And that information is de-identified. So there's no PHI, there's no names, there's no nothing other than here's the number that meet criterias, 1, 2, 3, 4, 5. To make it unlikely that someone would be able to say, oh, I think they're talking about this patient who I know has, this diagnosis or whatever. It does not return a value if there are less than 10 records, okay, that match the criteria. And again, it's great for hunches. So if you've got an idea and you're thinking about whether it's a clinical research project or it's a quality project, what have you, or you want to consider a cohort identification, that kind of thing, SlicerDicer is great for that. The other thing is because there's no PHI involved, we had a prep for research required if you were considering using it for a clinical research project, but just about 3 or 4 months ago, we removed that requirement, excuse me, because again, after looking at how SlicerDicer has been used in the aggregate, the feeling was by Lifespan Legal that we were not concerned about a HIPAA violation. The other level is detail view, and that is patient level. The degree to which PHI is displayed is model specific. In some cases, you simply get a list of, let's say, the patient's name, their date of birth, the MRN. And in some cases, you can open the patient's chart from that detailed view. So the way we have it set up now for most of the models is that in order to see the detail level, excuse me, a request has to go into OpEx. And then after you've constructed your query, you would share that with OpEx. I'll show you that in a minute. And then they would provide you that little level of detail. So this is just a screenshot of a spreadsheet that is really for the model that we're currently constructing called our visits model. And so this is kind of where the sausage comes from, if you will. And you can see there under column B, I know it's a little bit hard to read, apologies, that's the name of the filter and then the description of it and what category it sits in, et cetera. So essentially what we do when we consider a model is we literally go through each one of these parameters, okay, that all have a location in the database, what's called a lineage, where it's being pulled from, and we say, yep, that's something we use, or no, we don't use it. We make the filter active or inactive. We look at the definition. We decide if the definition is, if it's going to return the information that we think it's going to return, and when people use it, is that what, if people think that that's what they're getting, is that what they're, are they going to get that as based on the description? Do we need to change the verbiage of the description for users? And we go through all of these decisions for each one of these filters. And then it's now actually much easier. The lineage or the mapping location is easily located. It used to be when SlicerDicer first came out, it was much harder to track down exactly where the data, where that parameter was coming from, what field. But now it's easy. So we can look at the field and say, uh, yes, we're confident that the way the information in that field is being collected is legit, and we're going to include it in SlicerDicer, or not. So as wonderful as SlicerDicer is for many things, it does have a significant number of limitations. It's important to go through that. So Epic has a number of databases. The main database is what's called Chronicles, and that's what Hyperspace runs on. We have a reporting database called Clarity, which, for example, if you put in a report that has a long date range, it's a complicated report, typically that, because it's a complicated report, we don't want to slow down our main system. That report is written against the Clarity database, which is essentially a shadow of our main Chronicles database. And then we have another database, again, Epic loving their wonderful names, called Caboodle. And that's where SlicerDicer pulls from. Now, unlike Chronicles, which gives you information in real time, Caboodle is about a day old. So it's not, SlicerDicer is not acceptable for real-time reporting. You can't look at it and say, let me see if any of my patients have X, Y, or Z today. It's not designed to do that. Also, it is only able to pull discrete data from particular fields. So if you're interested in, let's say, pulling free text from notes, maybe someday we'll get to that, but that's not current functionality that SlicerDicer is able to pull off. One of the other issues is that, again, Epic has done the heavy lifting here, but it may be that there's crossover between one model and another. So you might find when you're looking at the patient's model, for example, some filters you want, but there also is a filter sitting in the surgeries model, and those two SlicerDicer models don't talk. Now, we do have the ability to put in custom models, as I mentioned, but that is an additional service request. Another limitation, although Epic, I believe, will be fixing this, I don't have a date on it, is if you're interested in looking across a particular group. So let's say a group of cardiologists, you can look for the specialty cardiologist, but if you're interested in looking at, for example, patients of the Miriam cardiologists, you would have to construct a query and then share it with all those cardiologists and say, please run this query. And of course, that doesn't then aggregate the data. It gives each person their own data. So it's a little bit limited in that sense. I believe that's going to be fixed. Another issue that we've run up against is some of the security controls. It depends on which model you're talking about, but for example, the surgery and procedures model currently does not have any way of restricting someone from seeing other surgeons' information. And as you can imagine, sometimes that gets a little touchy. So we've had to work through some of those issues. And that's by name, by the way. So for example, if I want to say, give me all the surgeries, give me all the posterior lumbar fusion spine surgeries, SlicerDicer will do that very nicely and will show me all the surgeons and how many they've done and whatever other pieces of information I want. So again, that's going to be fixed. Don't have an exact date on that, but they will be putting in some additional controls. As I mentioned, all results are de-identified, so in general, that's a good thing, but if you do need patient-level detail, that does require an additional request, okay? And so we know that with these limitations and others, because you may not have a particular filter you want or may not work in exactly the way you want, SlicerDicer is not ever going to replace all reporting requests. I think if we're lucky, we're in the 50 to 70% range. But again, it's great as kind of a first pass, do I want to go down this rabbit hole kind of question. There's no question that if once you get a cohort identified, then you might need to put in a report request. Sorry, let me just take care of that. Apologies. And and so you'd have to put it in this refined reporting request, but that's okay because you've already done a lot of the heavy lifting. And if you send the report writer, hey, here's the query that I wrote in SlicerDicer, that gives them a leg up on really trying to understand the specs that you're interested in. Another thing about SlicerDicer is that it's deceptively simple. And by that I mean, you look at it, and we'll look at it in a little bit. It's kind of sexy. There's all these pretty colors, and you go, hey, this can't be that hard. When in fact, the learning curve is higher than it appears, because it's really important that you understand your query structure, as it will absolutely affect the results that you get. And it's very easy, depending on the way you put your query together and the sequence and the Boolean logic that you're using and or not, those kinds of conditionals, that you'll end up with, you may end up with 3,000 results in one case, and in another case, 2,500, and you think, well, what did I do differently? And so there are a lot of nuances to its being used. You can, if you created a query that you're going to want to run frequently, you can actually export it and put it on your Hyperspace dashboard. But right now, it's only a private view report, so it can't be shared, although, again, that's going to be fixed. So let's talk a little bit about SlicerDicer control. Again, there's the levels. So again, there's the data model itself, okay? And so depending on who the model is for, we will expand or restrict the access. So obviously for the patient's model, that would be available to all clinicians. The surgery and procedure model, that probably doesn't make sense to make it available to an internist. On the other hand, we made it available to surgeons, as you would imagine. Once you've decided on your model, you need to start with the base population, the starting population, and then you apply filters and you slice those filters, meaning if you want to compare a particular filter, values from a particular filter, you can do that. And again, we'll see that in a second. There are different measures that are available depending upon the filter that you're talking about and the model you're talking about. So not all measures are available in all situations. The most common one, as you would imagine, is simply the count. How many surgeries meet these criteria? How many admissions met those criteria? But in certain situations, you can also look at the average, percentages, etc. There are different types of views, so you can look at your standard traditional bar graph, vertically or horizontally, stacked graphs. There's even a geo display by zip code. And then you can slice it by different data intervals. So I'm sure everybody wants to see SlicerDicer, so bring on the show. A few more screenshots before I do the full reveal. These are the models, as I mentioned, which we currently have in production. And so when you log into SlicerDicer, which is at your top menu, one of your top menu items when you're in Hyperspace, depending on the models to which you've been given access, you'll see these particular models. Again, the patients in the lower left is the one that everybody will have access to. Here's the menu selection, okay? And then this is what you see. This is the patient's model. It's a little bit small, and I'll show it to you blown up in a little bit. But what you're seeing there is 2.4 million patients that are in our system that you have the opportunity to write query against. And you can see what I mean by all the pretty colors. There's a tutorial, and it starts out with saying, okay, what is the population you're interested in? And then it talks about slices. Read that. These are the measures that again, you're going to decide how do you want to see it, counts, averages, etc. And then how do what's your visualization? You want a bar graph, a line graph, etc. You can change the colors. You can change the labels on the axes. You can change the scale. It can either be automatic or you can manually decide the scale. And then, like I mentioned, you can slice it and you can show it by the full date range. You can show it by year, by quarter, by month, by week. So again, this is just a screenshot of number of patients. And in the middle there, you can see that singular vertical bar. And then over on the right, you'll see that the base population, in this case, I've set it at all patients. In this particular model, you have the opportunity to say, hey, I'm only interested in my patients. I want to see, so I've got some hunch about my own patients. And so you can specify that and then specify what your relationship is to those patients, and then only see it. So if you're an attending or you were on the care team, or if you're their PCP or what have you, okay? So in the patient model, these are the filters. And again, this is a screenshot. It's not all of the filters, but you can see the kinds of grouped items that, Epic has put together. And the gold folders have multiple filters beneath them. So those are grouped folders. The blue are their own filters. So whether it's allergies, lab components, patient demographics, chief complaints, what have you, those are different filters. Here's the surgeries and procedures, and I just picked one of the gold folders that was case, and I expanded it, and you can see all of the different filters within surgeries and procedures. So again, whether I'm interested in specifics about the case, such as what the procedure, how many of procedure X was done, like a posterior lumbar fusion, or whether or not it was actually performed, what supplies and implants were used, or I'm interested in who the staff was, or the durations in the upper right-hand corner there, such as how long did it take to get the patient from when they checked in to the pre-op holding unit into the room, and how long was the surgery, and how long did it take from when the patient came in the room until the surgeon dropped the knife. All of those kinds of things can be looked at. This is a relatively new one that went in about, probably 4 or 5 months ago, our imaging studies. That's self-explanatory. Again, specifics on the exam there. And this one's not terribly interesting if you're a clinician, but our financial services folks are very interested in this. Is open denials that we're getting, and you can see again some of the filters there. So now I'm going to live on the edge a little bit here. I think I have to stop sharing. Actually, you know what I'm going to do? I'm going to go through the presentation, I think, and then come back to SlicerDicer Live. That way, I'm going to make sure we have enough time, and I can then just turn the presentation off. So I'll come back to that. So a couple tips here that I'll try and show. You want to get your base population as specific as possible before you start slicing and dicing. So it's your base plus, and in this case, I decided to do a little COVID experiment. So I put in patients who had COVID tests, and specifically I was looking at abnormal SARS-CoV-2 tests. You'll see this when I show it, but that vertical bar of 2.4 million patients, you can compare by clicking on the slice all patients, and you'll see that in a little bit. Okay, so that's a right click on the bar itself. The data models are all different, and so while there are certainly similarities in the way you slice, create your base populations and slice, some of the nuances are different between the models. So one model is one model. Not all models have a My Data option. As I mentioned, the surgery and procedures do not. And obviously, they have different filter sets. The linkages are very important, and this is one of those nuances. So you can see on the left there, the little green chain link, and then it's white on the right. What that means is that that little link says, are the different slices you're looking at linked, meaning that they're in the same encounter? They have, meaning that that the criteria had to be met from within the same encounter, and that's the green. If on the other hand you click it and then it turns white, in other words, the chain is unlinked there, that means that within the date range that you have chosen, both of those criteria have to be met, or either one, depending on whether it's an and or an or logic. But they don't have to have been met at the same time. They simply have to have been met within the date range. So again, those are some of the nuances that if you want to say, I want all of these criteria to be met within a particular encounter in a given date range, you have to make sure that your linkage is correct. I already mentioned the hover over, the right clicking on the bar. But the other thing that's very valuable is hovering over the bar. And when you do that, Epic has done a nice job of showing you exactly what your query criteria are. So in this case, I started with all patients, and I basically said, give me the patients who had any one of those procedures, okay, and for the same encounter, an abnormal SARS-CoV-2, and do it between the state range for obvious reasons. And that just, again, whether it helps you take a look at what you've got, make sure it's what you want, or queue up a query, a report request for our reporting team, it's extremely valuable. It shows you, any of, all of, and again, it tries to put it in plain language. There's also an advanced logic button, which I'll show you, where you can actually specify your Boolean logic. You can save your queries, no surprise, and these are a bunch that I've created along the way. One I'm going to show you is the one there that I've highlighted, but I've got some anesthesia-related stuff, some surgery-related stuff, things related to the problem list. And so once you save these, you can then share them, as I mentioned. Okay, I'm going to stop sharing here. And any quick questions while I'm pulling up Epic here? Let me log on here. Hang on one second. Okay. Let me share my screen again. Alrighty. Where is live chart? Oh, here it is. I think this is it. Okay, let me know if you can see SlicerDicer. All good on seeing SlicerDicer? Okay. All right. So this is, I've logged on, and the menu is up at the top here, the menu item for SlicerDicer. I've got my data models here. I'm going to select patients. And as you can see there, it pulls up my initial, this is all the number of patients in the system, okay? Now, what I'm going to do, let's see if I can move this little bar here. Put it down there. I'm going to say, okay, I could say just show me my patients here, and I showed you that screenshot, but I'm interested in all patients. And I'm going to say, let's put in, let's go to procedures. And let's put in COVID. And you can see that now. Remember, so here's a nuance right now. So we think, oh, I'm going to order a COVID test. So this is going to give me my COVID test results. No, this is simply show me a procedure that the number of patients that had this procedure ordered. Okay, so this is a procedure COVID-19 procedure grouper. There are a number of records here. You can see these different little icons, and I'm going to just check all of them. Whoops. And I will tell you, by the way, that these, don't believe these numbers because SlicerDicer, the Caboodle database, is still backloading from our upgrade. So these numbers are going to be off. Okay. So I come up and I say, all right, there were 61,000 orders that were placed, and now let's slice that by looking at how many of those have an actual result, and then of course what we're really interested in is how many were abnormal. So I'm going to put in a filter here, lab components. I could also just click on the folder down there. Now, what we're really interested in is the component in the lab, which is the SARS-CoV-2 component, and we'll accept that. All right, and that's telling me now that I've got 45,377, but that doesn't mean that it's normal or abnormal. It just means that there was resulted. So if I click on this particular filter here, I can now say, just show me the ones that are abnormal, okay? And if I was interested in whether it was a final or not, or maybe if there's any comments, I can search for that as well. But I'm going to click on abnormal, and when I do that, you'll be able to see a quick change there in the number of patients who return with an abnormal result, okay, based on this, 2,500 roughly. Okay. And now I thought, well, shoot, maybe I'm interested in how those patients fared with their oxygen saturation. So let's take a look at that, and let's slice this by, we're going to go to the vitals folder, and then we'll go to SpO2. And when we do that, you can, and Epic comes up with some defaults here. But what I'm really interested in is how many of these folks were less than 94. So you can see the breakdown there. There were a few unfortunate people who had positive results with a SAT less than 54. But I'm just going to be curious here, and so we're going to actually we are going to scroll and move this, hopefully. Oops. I'm trying to delete this. There we go. Let's delete that. And let's delete that. And let's move this to 94. Let's see how we're doing on time here. Okay, so I've got the majority who were over 94, but a few unfortunate folks who were less than 94. And now what I'm interested in is, so these folks, let's say we're saying we're hypoxic. How many of these people came in with a chief complaint of shortness of breath or cough? So again, I'm going to right click. And notice, by the way, before I do that, I can hover over and I can see exactly how I put my queries together here, okay? As well as the number there, 1994 and 953. So if I right click, and I'm going to slice this now, I'm going to say, let's go look at chief complaints. So I'm ignoring the ones now who were greater than 94. I'm just going to look at the ones who are below that. And I'm going to put in shortness of breath, and I'm going to put in cough. And let's see what we get. Okay, so I've got 410 who came in with 140 and 146 with cough. But now what I want to do is I want to compare that with those who didn't have either one of those. So I'm going to click on compare to the rest of the population. And so now what I've found is I've got, of this group, I've got 480. They were hypoxic, but they didn't come in, well, they didn't have a chief complaint at any rate, of cough or shortness of breath. And by the way, I can combine these two total. So to make it an OR logic, I can group shortness of breath and cough and just call it shortness of breath or cough. So now I'm basically comparing COVID positive patients who were hypoxic and then whether or not they had a chief complaint of shortness of breath. You can see it's roughly 50-50, okay? And I can take that and I can change the way the dates display. Right now it's showing me the last 6 months, but let's just say, first of all, that I want to, this is interesting because this literally just changed with the upgrade. The date work used to be up here and they've just moved it over to here. So let's look since the 1st of April to present. Okay, so now all of a sudden I'm going to get those new numbers, and now we're going to show it by month. So that now what did that take? Maybe 5 minutes or so. Now, to be fair, I played around with this query, obviously, in preparation for the talk, and probably spent about, I would say, an hour or so messing around with it so that I felt pretty comfortable with what I was going to show you. But an hour is a whole lot better than 3 or 4 months. And again, you can change your hunches on the fly. So, and you can see there for this particular query, obviously we were high in April, we're going up in October, and unfortunately November is still underway, and this is month to date for November. Again, it's more or less equal that we've got these patients coming in who are COVID positive, hypoxic, and yet only about half of them have a chief complaint of cough or shortness of breath. It is quarter till. I'm going to stop, and I'm going to stop. Well, maybe I won't stop sharing in case anybody has any questions, but let me stop talking and thank you.
Thank you, Richard. This was absolutely terrific. Really helpful. I really appreciate your kind of taking the plunge of trying to show it to us in real time. I think it's very helpful. I'm going to open it up for questions. I saw there was one question from William Brown about, does the saved query update when reopened at a later date? And I'll ask you to answer that, and then I'll open it to other questions as well. And William, if you want to unmute, you're welcome to add on any further elements to that question.
So thank you. So so here is, I can save a query, and you can see here that I can put the date range in, so I can fix it for a particular date range, or I can just say current or start from beginning. There are multiple options here. So depending on which one you want, and then you save it, when you reopen it by going to, let me cancel out of there, by going to load here, it'll automatically update, depending on the parameters you've chosen when you saved it.
Richard, one other question. It is not possible at this point to use this for doing chart reviews. So like, for instance, if I have a bunch of study participants and I want to see what percentage of them came into an emergency department over the 6 months after they were enrolled, it's not currently possible. This is done on an aggregate basis. You can't put in specific patient names or MRNs and then create an aggregate report this way. Is that correct?
That's correct. You could, if you got, you put a request in and got permission, you could get it the other way, in that, you could see the patients who met particular criteria, but going the direction that you want, no, you would not be able to do that. That's correct.
Still super cool. Other folks' questions? I'm sure a bunch of you have, yeah.
Hi, this is Erin Ryan. I do have a couple questions. Thank you so much for this talk. This is really helpful. Is it possible to sort by setting? So keeping with the COVID test theme, can you search for COVID tests ordered in the ED as opposed to inpatient?
Yes, the way you would do that is, there are a couple ways you could do it. One is, you could essentially, after you do your all patients based population, you can search by show me a given department, or and so let me just bring up here. And again, I think, as I mentioned along the way, well, actually at the beginning, Epic is going to be giving greater functionality on that, right? Because it's not as good as we would like it to be. Let's see here. So you can have encounter locations. Also, when you're looking at diagnoses, I believe you can, let's see here. You can, for diagnoses, let's just say congestive heart failure. Let's do, of course, I picked something complicated here. Let's just grab the top 10. This is going to be totally crazy because I'm doing this on top of, I should have just, you know what, let me just start over. I'm going to erase all this and you can see how easy it is to do. Let's put in diagnosis. And I believe that you can, yep, there it is, ED diagnosis. So for some reason, they thought, well, people might want to know whether or not the diagnosis was placed in the ED. So that's a nice little feature. You can say, I don't care where it was diagnosed. You can say, I only want to see it if it was marked as chronic on the problem list, or I only want to see if it was an impression off the ED.
Great, thank you.
Mm-hmm. Any other questions?
I see a question from Chris Tucci. Chris, do you want to ask this yourself? If not, I'll read it. Chris asks, is pathology staging available through lab component slice? That's a great question.
That is a great question. When you say pathology staging, are you talking about preliminary reports? Or are you simply talking about the final report?
I'm not sure what Chris meant. I would surgical final path, they say.
Surgical final path. So the way pathology reports work, and I know this because we had to deal with this for the Cures Act, is a report in COPATH will remain preliminary until it's finalized, and then once it's finalized, it will go into EPIC. But the issue with pathology is that it's a narrative report typically for COPATH. So remember I said early on that SlicerDicer looks at granular data. So unless that piece of information, I mean, I'll use the obvious example of like a CBC, is sitting in a particular field, SlicerDicer is not going to be able to pull it. If there's a particular lab value associated with that report, then yes, it will be in the field. So you would be able to see the order of a procedure, let's say a biopsy procedure or a COPATH order, because that will be entered into EPIC. But I haven't played with that, quite honestly, but I am probably 85, 90% certain that at least right now that would not be available. But I have to look and see.
Hopefully someday we'll get free text.
Yeah, hopefully.
A related question is whether or not there are genetic testing results available.
I'm sorry, that was my dog.
Oh, that's okay. This is the joy of work from home. We're all getting to know each other as fur babies and real
That's
babies.
right.
So,
can you repeat the question, Megan?
Yes. Rashid Till asks, do we have genetic testing results available?
Again, any result that has a discrete value should be in here. And so it would be a matter of knowing, particular, if you gave me a test name, then I can look it up. So I don't know what would be, but let's just say, well, there's a trisomy 18 risk.
What about like BRCA or something? I could imagine that like we try BRCA. I wonder. It's a commonly offered BRCA. No, there Yeah. Oh,
Not seeing it. Those are the kinds of things that, again, if it's a granular piece of, if there's a field where that value is being recorded as a lab component, it should be there. But I can't swear, obviously. And it may be something that if you said, hey, this is really valuable, that we would be able to construct a custom filter for. And my guess is that there are a number of kind of esoteric things that, again, SlicerDicer is in that, it's that first hunch, 50 to 70%. If for very detailed, absolutely accurate reporting, there's no question that it's not going to cut the mustard. Be completely upfront about that. But it's a good first step.
Yeah. And I think, for those on the call, it'll be interesting for us all to go and sit and play around with it. And Richard, am I correct in saying that if we find that there are features that a large percentage of our department or our lab would find super useful, to let you know? Is that an accurate statement?
Absolutely, yeah. both in terms of a particular filter that is of interest, and also, if you look at the data models, and Megan, I'll certainly send you the presentation. You can send it out.
you.
If there are particular data models that you go, hey, that one's not live, and that one would really benefit a lot of people. That's the feedback we need, because we've kind of picked off, I'll say, the ones that we know everybody wants, and now we're like, oh, which one should we do next? Well, like I said, we're doing visits because we knew that was important. I'm interested in anesthesia, as others are. I think admissions will be another one that's important. But we're kind of getting to the point where, well, what are we hearing from the masses, kind of thing. I just wanted to point out, when you click over here on help, it'll take you through a tutorial. Definitely should do that. Absolutely.
That's awesome. Now, Heather Chapman commented that she can clarify one point. Heather, do you want to unmute and
Great.
clarify?
No?
Maybe people are having trouble unmuting.
Oh, now I got it.
Yay!
Hey, multimedia here. So Richard, that was great. I'm hoping that this really fosters people to just kind of take some time and try it out. One of the things that Dan, Sarah, and I are finding as we're working with the pediatric divisions that you highlighted is that if people want to find useful information and they're using the My Patient filter, that you really have to be paying attention to how you're identifying yourself. I know I do inpatient usability for my role, and we automatically put ourselves as part of the treatment team. So if you're in the ambulatory setting, I think you have to be more active as making yourself part of the care team. That's going to impact, if you go into use SlicerDicer, it's going to impact when you're using this My Patient function. You've got to make sure you're identifying yourself as part of a patient care team. It's not something that happens automatically.
Yep. And that brings up a really good point. And, that's true for every single report that you're going to get out of Epic or any other database for that matter. And that is, it's only as good as the information being recorded, which is, one of the things, to be frank, that when you start to cross over from a clinical database, which of course this is because we use it to take care of patients, to then saying, well, I'm interested in doing a research project, it can be tough because you don't know what you're getting. You don't know how accurate the data are. So, I mean, there are other tools. I'm going down a bit of a rabbit hole here, but there are other tools such as some of our registries and things like that really are more designed to ask some of the more the questions against a very, very rigidly collected group of patients. But again, SlicerDicer is not designed for that. It's designed for that first pass, multiple hunches kind of approach. Any other questions?
I'm interested, has anyone, as kind of a last thing, is there anyone on the call who's used SlicerDicer and wants to offer kind of thoughts or comments that others can take away as best practices or tips that you learned in using it?
can see it's a rousing success.
I think that's part of the reason why we did this, Richard. I think that a
Right.
lot of folks kind of know that it exists, but don't
Yeah.
quite know. And I know this came out of a discussion that we had with Aaron Ryan within our Department of Emergency Medicine, that a lot of
Yeah.
folks know that it's there, but haven't really understood how to use it. So
Yeah.
actually, I have one final question. This
Sure.
is available. You're obviously logged in as a clinician. This is equally available to our folks that purely have research access to Epic. Is that correct? That'll be actually a very important detail.
Yep, great question. So 2 comments there. One is, if I think the answer is yes, but if that's not the case, then it would be, a security request to get access. The second is that there is a research model. I have not looked at in detail, and I'm not sure, what the filters are in it. But that's something that I'm interested in looking at and seeing, whether or not how applicable that is to our users, and if it be a model that we want to stand up. I'm not sure what that means exactly, because on the one hand you can say, well, what does that mean, a research model versus a patient's model or anything else? You're going after, just depends on what fields you're interested in. But there may be some specific filters that are unique to the research population that they would be interested in. So that is something that we need to look at.
Awesome. So, and I'll say there that if there are folks on this call who are interested in looking at that and want to create a little work group, certainly let me and Dr. Gillerman know, and happy to help facilitate.
Yep. Absolutely.
We're excited to see this used more. I think one of the things that's been really exciting to me, sitting kind of on the research as well as the clinical end of Epic use over the past few years, is seeing the degree to which they are enhancing the technology with more tools that are appropriate for us as researchers, and also watching them be responsive to requests. So please do give us feedback as to kind of when you use it, what barriers you face, what best practices, and we'll work with you to help make it better. On that, it is 1:59, so
Right.
I will close up on time because I know a lot of folks have next meetings to get to. I think we're taking, do we have a session next week, Leah? I actually have to look at my.
Yeah, so we do not have one next week, but our upcoming one is going to be on December 2nd. So look for that email. We'll be sending out an email to our listserv, as well as posting on social media with more information about that.
Thank you, Leah. And I'll also add one other plug, is that on December 14th through Brown Med School, through Alpert Med School, we're doing a Decoding Disparities series of presentations. And on December 14th, Desmond Patton, who is a social worker at Columbia University, is going to be presenting on his work using social media to decode disparities around race and violence. And it should be a terrific presentation. So save that date as well. Thank you all. Stay tuned for more, and we have a very healthy next couple of weeks, and please don't get together with big groups for Thanksgiving and wear a mask indoors. Always.
Absolutely.
All right.
Stay safe.
Take care, everybody. Thank you.